Worryingly, deaths which are linked to heroin misuse and morphine-related medication abuse have more than doubled since 2012. Was that your choice to come off it completely, or...?
Well, I wanted to get off it quick as soon as I found out my wife was pregnant.
The patient-doctor relationship is the most important part of general practice. You need it to be able to function as a GP.
That's the delicious looking doctor.
I'm not sure about that. Most people say, oh, he looks like David Cameron.
It's true.
If I see a patient who fears having an operation, my approach is usually to try and understand why first. 90% of our job is listening to patients.
Being straight with you, I'm scared to go to the hospital. I'll be honest with you, I even know it's a local and I know I'm awake. I don't care, I'm not going.
OK, right.
So, your daughter, you said, had called the ambulance, is that right?
She was crying. She thought I was dead.
Good morning.
Colleen McFarlane, please. Oops. Hello there. Come in, Colleen.
Thank you.
Right. What can we do for you this morning?
I've got this thing on my hand.
Yes.
It's sore and it's getting bigger and bigger, and I've put water removal on
Okay.
it, and it doesn't go away.
Right. And how long have you had it there
A
for?
couple of months.
Anything like this before or not?
No, and it's sort of this part here is getting bigger.
This is what's called a keratoacanthoma. Big name.
It's a wart.
Not quite a wart, no. Kerato means nail, and thoma means sort of a growth. So essentially, if you feel this in the middle, that's essentially nail.
Yeah.
And these lesions grow quite quickly with some redness, a sort of fleshy bit around the side, and they form a nail plug in the middle, and they can just keep getting bigger and bigger and bigger. But just looking at the size and everything, I think this is a benign lesion.
Why is it sore, though?
Because that bit is on a fleshy bit underneath, and when you press it, it's sort of on an open scab.
Because I always file it down so it doesn't catch. I take a nail file
And that's absolutely fine. A lot of people do that.
Yeah.
But it's quite uncomfortable doing that, I would imagine, because it's like a little plug of a volcano sitting on open skin underneath. I'll see if I can find you a little leaflet about it.
Get rid of it?
You have to cut them out if you're going to.
Okay, because I do have private medicals.
Okay, I can refer you to one of the dermatologists locally who will have a look at it and then probably remove it for you. Yeah?
Yeah, and I'll be awake.
You won't be awake.
I had an abscess under my arm. I went to the doctor and he said he's going to lance it. Well, he said, think of a nice sunny beach, and I did, and he just went zap. Oh God, I don't forget it now.
I bet you won't. You're obviously traumatised by it. Okay, and then I'll do a letter, and then that'll follow it up.
Oh, fabulous!
You're welcome. Take care then. Bye bye.
Bye bye.
That woman asked me 5 questions in a row. She goes, just one more thing. Sound like Columbo. Just want one more thing.
Columbo.
Yeah, he used to say that, didn't he?
He's my favourite. He's my hero. Him and Miss Marple. That was been my nickname since I've been at school, Miss Marple.
No reception, Cindy speaking. How can I help?
Where's my phone?
I did put it on top of Nanny's handbag, so it's probably on the kitchen side.
No, I put it off and put it on the charger.
Ashanik Richards, please.
Come on, let's go.
Come in. Hello, come in. Have a seat, please. Right, how can I help?
Right, I rang for advice the other day, and they told me to come back in because I need to get her referral pushed to urgent rather than...
Okay, let's see what it is.
Yeah. It's just like normal because It was about her fit. Well, it was like seizures, I explained to the doctor, and she thinks it was like, could be a form of epilepsy.
Okay.
But
Usually we do it as urgent, if that's the case.
But when I rang up the other day, they said it wasn't. But what I actually did do was record it.
Should we have a
so
look?
that I've got proof of what it looks like. And to me, it looks like the start of a fit. Started happening last March.
Mm-hmm.
She took an overdose and she ended up in hospital for a week. And the seizures started then.
Did they say it was related to the overdose?
No.
Okay. What did she take?
It was a concoction of like drugs. She was out with her friends.
Okay.
And it was a concoction of things. And she called them bang bangs, these little silver canisters. And it was that, yeah.
Okay.
So how are you?
I'm fine.
Yeah.
Just before we went on holiday, I had to come for a blood pressure, and it was high. So the nurse said to make an appointment to see the doctor. I saw Dr. Giovanni. I call him Giovanni. I don't know why.
He's suddenly become Italian.
And he increased my blood pressure from 40 to 80 tablets.
Okay. Yes. Yes.
Then he said, make an appointment to see the nurse again. Took the blood pressure and it was high.
Yeah.
So he gave me some other tablets to take.
Yeah.
But they made me ill. They gave me diarrhoea, chronic stomach pain. So I left them off.
Good. Good.
And then I thought, I'll try them again.
Okay. Yeah.
So I started trying them on the last Saturday, and I've been okay. My poo is a little bit stodgy, but it's not.
Okay. It's not constipated.
No, and it's not runny.
Okay. At least it's not runny. Yeah. Yeah. Very good.
And I've been okay.
Have you got a machine like this at home?
Yeah.
Good. And do you keep a record of your blood pressure?
I did a record and gave it to Dr.
Jumanji, yeah. Good. Well, if I can just get you to hold that one for me, Barry. That's right. Says, well, you brought him along.
Yeah.
Yeah, so we just don't talk while we're just doing this.
(141/77).
Good, very good. And the heart rate, 98. Okay, very good, excellent. Yeah, keep taking them.
He gave me a
Yeah,
month's supply.
yeah. I'm going to put them on your repeat. Yeah. Well, I'm delighted at your blood pressure, and it's really good. I'm really pleased.
I got transferred from you to Dr. Gennardi.
I know. Temporarily, we gave him the list, but I'm opening a list again.
He's a
That's a great
If we
doctor.
get back with you, we can.
Yeah, you'll be able to do that within a month. You'll be able to do it. Yeah,
He's okay.
He is
fine.
nice.
He's very nice.
I've never had any problem with any of the doctors here.
He's off to see his brother in
Fiji.
That's right. Yeah, amazing trip.
And I looked up the flight, 27-hour flight it is, and I thought,
Really?
I don't think I could handle 27.
27 hours, he'll end up piloting the plane himself.
All right then, thank you, Doctor.
Yeah, nice to see you, Barry. Yeah. All the best. Nice to see you.
Right. Yeah, have you got the video?
Yes.
When was this?
This was Thursday.
So she was sleeping?
No, that's her, innit? Her eyes are rolling in her head. She's awake, but when she's like that, she's not responding to you. And her breathing's funny. Can you hear the breathing?
So she was awake at this time?
Yeah, she was
What
awake,
was she
yeah.
doing before this happened? Because she's lying down at the moment.
Yeah, because, when they come on, she can feel them coming. And we was downstairs, and she said, Mum, can I come to bed with you? So I said, right, yeah, OK. So I had to hold her hand because her legs started to go as well. So I held her hands, took her upstairs, and I put her in the bed. And then she laid her down, and it was a few minutes after then that it all started, and her whole body was shaking.
Mm-hmm.
But they weren't forceful, like convulsions. They were.
Okay. And when was this again?
Thursday.
And how frequent?
But before they weren't like this. So it's like they're changing and they're different. Because before it's almost like people talked to her and she was getting like dead people talking to her, and she would cry.
Yeah.
But when they first come in, she smiles. She's got like a silly grin on her face. So I always know when they're starting to come as well and like she clicks her tongue. She hasn't actually had one since Thursday because they're not every day.
Yes.
Because
occasionally.
before she went a good few months without having one, but then they come all of a sudden again.
So you want the referral? Usually that's what we do.
Yeah, apparently it's been referred, but it's not on as urgent, and she
Okay,
said
no,
it
I
could
will-
take a long time, and I'm thinking, oh, it could do more damage than good.
Usually they're very good. I mean, they usually triage their letters as well, and if the thing is urgent, with pediatrics, they're very
Because
good.
I still haven't heard anything.
No, don't worry. I will
strange,
make it
yeah.
as I will ask the admin team to change it to urgent. So we'll resend it as urgent. So hopefully you'll receive an appointment. But if you're not getting an appointment early, just let us know.
Okay, great. Yeah, because they were telling me like 6 to 12 weeks, and I was thinking, oh gosh, that's a long time.
I wouldn't worry. You should hear within the next 1 week at least. Okay, anything on video would be really helpful for the pediatricians to see as well.
great.
Okay?
Thank you very much.
You're welcome. Take care. Bye-bye.
Bye.
How can I help you today?
I'm finding it very, very hard to breathe.
How many days has this been going on for?
This has been going on for months.
What did they say you've got? What's your diagnosis?
Avian lung disease, hypertension, pneumonitis.
Hypersensitive pneumonitis. Okay.
Yeah.
Okay. Let's have a look.
Sorry, doctor.
It's okay. Let's have a look at your last document. Take your time breathing. Let's just...
And
Let's have a quick look. Let's open your last chest clinic. Hypersensitive to birds.
well, they told me to get rid of my birds because I had about maybe 500, 600 different types of birds.
In your house or in the back? Where was this?
Aviaries. Because I've always had birds from the age of 7.
Is this in your garden or in a special...
There were some specialist birds indoors, which I can understand was giving me this problem. So I got rid of all of them because it was very hard because they've had them since young birds.
Oh.
And I got rid of nearly 300 of them indoors. The others out in aviaries. And I don't even look after them anymore.
Where are these aviaries? Are they in your
In the garden.
In your garden?
All around the garden.
So you had 500. Wow.
Believe it or not, I got myself some squirrels. They're not feathered. So I've got chipmunks and...
Is that in the house? Or...
That's in an extension, not in the house itself.
Let's do your temperature.
Yeah.
But the problem is all these things are causing sensitivity to your lungs. And the pigeons and the birds, obviously...
They've gone now.
They've gone, but cleaning them out, their faeces, their stools, their feathers, everything has caused the damage in the lungs, OK? How many days do you feel now it's got more wheezier? Is it in the last 2 days?
The last day. This cough as well. It's not like before. It's big lumps of, phlegm.
What colour is the phlegm?
Normally it's that opaque yellow. But last few days and a couple of times, it's had a blood streak in it.
Right.
I'm coughing up blood, I know that.
Has the phlegm turned green or is it still yellow?
It's green.
Now it's green. OK,
Yeah.
how many days has that been going on for?
I would say at least a week.
OK. Let's have a listen to your chest. Stand up for me, Mr. D'Souza. Let's have a listen. Pull this up completely. That's it. OK, nice deep breaths in and out for me. OK. So, take a seat, Mr. D'Souza. So, basically, when I'm listening to your chest, it's actually got very good air entry. So both sides has got good air coming in and out. I think you need to go back on 40 milligrams. Do you have enough steroids?
I have enough steroids at all.
This is an antibiotic that I want you to take 1 capsule 3 times a day.
Right.
Amoxicillin.
Yeah. Right.
And then on top of that, lots of fluids, paracetamol if you've got any pain. If you cough up pure blood, any fever, shakes, or the phlegm isn't getting better, or your breathing is not better, even if you're on 40, you need to go to A&E.
Okay, I will do that. Okay.
All right, and then come back and see Dr. Bolger.
Sorry, but...
It's okay. Well done.
Thank you for all your help anyway.
Take care, Mr.
Bye-bye.
D'Souza. Take care. Bye.
Woman this morning made me laugh. Toilet's out of order. She goes in there. Somebody's knocking on the door saying, can you not use that toilet? She goes, it's all right, I've been now. That's for people.
Ricky Purser. Yeah, come on in. Can I have a seat down there? How you doing?
All right.
All right, how can I help you today?
Where do I start? I've had a stiff neck for over a month.
Okay.
I've developed a cough.
Okay.
But because I live in a house that is It's disgusting.
Okay,
I've got someone who lives next door who urinates in the hallway.
That's not nice.
And it stinks of like smelling salts. Kicking the guy out, but it don't make no difference. He said he's not going to clean it because he keeps urinating in it.
So until he's out, he won't be doing it.
So it's just lots of things. My knee has got worse, but that's because I was assaulted the other day and it gave way and it keeps giving way.
So what do you need from me today?
I want a support for my knee.
Yeah.
I want some kind of painkiller because it's killing me.
Okay. What do you want at the moment?
Nothing. I meant to have seen a consultant and we had this ongoing thing because being straight with you, I'm scared to go to the hospital. That's what it really is.
Okay.
I'd rather have a support or some physio because I am not going. I'll be honest with you. I even know it's a local and I know I'm awake. I don't care. I'm not going.
Okay, right.
And I just want.
Okay, so we can do physio. I need to look at what the referral that was saying. But physio won't do anything if they think that orthopaedics still have stuff to do with you because they'll be worried about making it worse. And knee supports, we don't provide them. You've got to buy them. Unless they're provided through physio, if they like particular things like or in A&E.
I'm on benefits, so.
Yeah, no, but that's what I'm saying. So even if you're benefits, the point is you'd have to go to physio and then they'd have to say, yes, there's a particular thing, isn't it?
But if it comes to me to buy it, then I'll just leave it and then I'll just let it go and keep going. Because I can't afford it.
We don't keep them, they're not prescribable.
Yeah, no, that's fine, that's fine.
It looks like when you did see them, they were planning on operating, weren't they?
Yeah.
So that makes it difficult because the truth is what you need to do is to go back and see them and see whether that's still the case. And you
It's worse. It's a lot worse. It's still swollen.
So the bottom line is, right, pain relief I can do. That's not an issue, right? But a knee support I can't do. And surgery, if you don't go down the route of going back to the surgeons and seeing whether you still need surgery, then you're going to find yourself in a situation with a long-term problem.
Let me see if I can talk to him and talk him out of it.
Talk him out of what? The surgery?
Operating, yeah. Because
It's not about talking him out of it. He's just going to go and look at your MRI and go, it's worse. Last time I thought you need surgery, you're going to need surgery.
There is no way that I'm going to sit there while I'm awake. He can do it while I'm asleep, that's fine.
So what's the issue there about them keeping you awake? What do you mean? What?
Because I just won't be awake. I know I won't feel never, but you try to tell me.
No, but what I'm saying is they're not putting you under general because...
Because they said it's going to be a local. And there's no way I'm going to be awake.
Did you tell them that you've got a real phobia of that?
No.
Okay, they might work with that then.
You sure?
No, but you don't know until you ask them. Okay. I have an answer for you, okay? I will refer you back with the same original letter and I'll do a cover letter saying we're re-referring, you've got worse pain, and the reason that you keep not going back to them is because you're afraid about having surgery under a regional block and you would consider it if you were given general anaesthetic. Yeah. Does that sound right?
Yeah, that's fine. Okay.
All right. All right.
Thank you very much.
Take
Cheers.
care.
Thank
no
you.
problem.
Cheers.
I hope it works out.
Thank you.
See ya.
Thank you.
Bye.
Bye-bye.
What's been happening?
Well, it was the day before yesterday at about 8 o'clock in the evening.
Yes.
I don't know what happened. I slept in the room on the carpet and then I hit my head on the wall.
Yeah.
When I opened my eyes, I was in hospital.
Right.
So my daughter called the ambulance to come and get me.
Yes.
So after I get my sense back, I just discharged myself. Yesterday in the morning, I feel dizzy, headache. Even if I cough, I feel headache.
Okay, let's just have a look at your notes. So your daughter, you said, had called the ambulance, is that right?
She's only 13 years.
Only 13?
My daughter, yeah.
Oh, that was good of her.
She was crying. She said I was crying. They thought I was dead.
So do you have any idea how long you weren't unconscious for?
I've got no idea.
It says that you had an X-ray and a CT scan.
I don't know. They did do X-ray.
It says that you did.
Well, I don't know.
Okay, so it looks like the CT of your head was cancelled.
Oh.
Obviously, because you weren't going to stay.
Yeah. This is the blood pressure.
That's your blood pressure, yep. Okay, just need to shine my light in your
eyes.
Yeah.
just want you to follow my pen with your eyes. In this way. Any double vision there?
No.
Can you puff your cheeks up for me? And smile. Okay. Close your eyes really tight. Just don't let me open them. Okay.
I hit it here.
You hear your head there? Let's have a look. Does it hurt?
A little bit. All this part.
So it's quite a wide area, isn't it?
It's a wide area, yes. It's in here.
I think when you have an accident like this and you go along to the hospital in the emergency situation, they arrange lots of investigations.
Right.
Because they don't always feel they have enough time for the assessment.
I was a fool. I was like confused.
Mm-hmm.
I wish I could have known now that I couldn't get out of hospital. I was thinking of work because I did have a very important job tomorrow morning.
Right.
So my mind, after being awake from hospital,
Yes.
said, well, it was just a bang. There's nothing wrong with me. I'm going home.
But you've probably got a bit of concussion.
Yes, I did.
And with concussion, you can have a headache.
Yeah.
You can feel a bit sick and a bit dizzy.
Yeah.
And the best way to get through concussion is to rest.
To rest, okay.
And you can safely take some paracetamol.
Okay.
So is somebody going to be around for you going forward over the next few days?
I'm thinking of going to work tomorrow.
I think you're going to. What do you do?
I'm a carer. I work in a home.
Okay.
Yeah.
Do you feel up to going to work tomorrow?
Well, there's some people that need me very badly, so I think I will try.
Okay.
But I don't know. It's you to tell me if I can, okay. If I cannot, I will stay home. What do you think?
I think if you feel well enough to go,
Yeah.
that's okay, especially if they need you. If there's any reason why you don't feel well enough, though,
Then don't go.
go.
Okay.
Okay.
All right. Thank you very much, Doctor.
Okay. All right.
Okay. No
Nice
problem.
to see you.
Okay, no problem. I'll see you. Thank you very
Thank
much.
you very much.
I'm not so hurry, but I want to ask about the appointment for Saturday,
Right,
Sunday.
for Saturday and Sunday, unfortunately, those are pre-booked appointments only.
Okay.
If you do need an appointment for tomorrow or Sunday, you need to come back at 8:45 in the morning.
At 8:45?
In the morning.
Okay, okay.
And just check to see if there's any cancellations.
Okay.
Okay?
Okay. Okay, thank you.
No worries.
Thank you, bye.
Nice to see you again.
Right, and you.
Tell me what brings you in.
Right, I saw Dr. Napfi, my doctor.
Yeah.
And because I'm nearly off my methadone, I've been put on a rapid reduction. I'm nearly off it.
Okay.
Because we're having a baby.
Yes.
Basically, my chronic pain in my back and my legs has come back.
Joseph's been in a specialist drug treatment centre. Joseph started using heroin at a really young age. He was only 15. He's now 32. So a period of 17 years of using heroin. We have been reducing his methadone medication, and he's done really well.
You know what I mean? Being sat down all day.
Yeah.
If I'm either in this or on my mobility scooter, or I'm sat down at home, so that doesn't help at all with my back pain. You know what I mean? Because I damaged my back about 12 years ago carrying a washing machine.
Okay.
And like I was frozen.
Yeah.
I couldn't move for about 2 weeks. I had to move in with my mum. But obviously the leg pain has got worse and worse. But obviously when I was on methadone, that obviously helps with your pain as well.
Yeah.
And obviously I'm nearly off it now.
Your dose at the moment is
20.
And how long to go before you're going to be off it?
Well, 3, 6, 9, 10, so 11 days.
11 days, and you'll
I'll
be completely off. Okay. Was that your choice to come off it completely, or?
Well, I wanted to get off it quick as soon as I found out my wife was pregnant.
Okay.
Because I haven't been using the gear.
Yeah.
So I thought I can handle it. Do you know what I mean?
So we've got a few options.
Yeah.
And it's worth remembering that you are a patient who has chronic pain.
Yeah.
Okay. So getting this right first time may not be easy. Okay. The easiest way for me to kind of describe this is going to be to kind of draw it on a piece of paper for you. I think we're going to continue with your gabapentin, okay, for now. So if I put gabapentin here and I put a tick beside it and you're on top dose there. You're on cocodamol.
Yeah.
Which is that combination of paracetamol and codeine. Now, if we separate those two out, I would like you to carry on with the paracetamol bit to it.
Yeah.
8 a day.
Right.
And to replace the codeine, which is effectively 8 a day.
Yeah.
When it was cocodamol.
Yeah, but just one tablet.
I'm going to replace that with tramadol. And because we have shelved naproxen, I think we need to... This is a class of medicine called anti-inflammatories.
Yeah,
I think we need to bring back a type of anti-inflammatory, but I think we'll bring back the ibuprofen.
Yeah, I'm up for that and see how we get on.
See how we get on. The difficulty we have a kind of a stepped approach to pain relief.
Yeah.
And once at the bottom of the kind of approach is simple things like ibuprofen, paracetamol, the higher you get up the pain relief ladder, you're going to come into kind of opiate-based medications. And we do need to be careful in someone who's had a heroin addiction. Okay. Moving forward, if this is not working, can I suggest that you come back and see us?
Yeah.
Is that reasonable?
Yeah, I think that's...
Yeah?
Yeah, that'll work.
Okay.
Thank you, doctor.
It is a difficult situation. Remember I said you're already on opiate-based medicine now. And what we need to be careful and mindful of is one addiction can often be replaced with another. Yeah. And there's lots riding on it, obviously, with her expecting. That's good news. Are you ready for nappy changing and all of that stuff again?
Excited.
Good.
All right, doctor.
Take care.
Thanks a lot. See you later.
Bye.
Yep, take a seat in the waiting room. She'll call you shortly.
Glenda, you know everything, don't you? Do you know how long that glue's been out of order for?
Yes, a couple of weeks now. Some gentleman sat on it one day and the seat pinched his bottom. Alison told me to put that on there.
2 weeks ago. OK then. Thank you. All right, bye. That's why you're saying you're Miss Know-It-All.
Miss Marple, I told
you are, aren't you?
Unique. I'm Miss Marple.
Come on in and have a seat, Sean. Dr. Bolger. How can I help this morning? Something to do with that, I imagine.
Yeah, I don't know what's going on, but my INR is extremely high. It's 7.7.
I'm sorry, you're INR?
Yeah, because I had that blood test done this morning.
Right.
So I had to go and see the doctor about that.
Sean's had repeated DVTs, so that's a clot in the veins of his legs. Some people who have recurrent DVTs, the call's made that it's sensible to keep them on warfarin. And Sean is on lifelong warfarin. Why is that shot up? Been taking any tablets for this?
I've took Anadine.
Do you know what's in it? Because Anadine's a brand name.
Yeah.
It's got anti-inflammatories in it.
No, I didn't even check. I was in so much pain I didn't care.
That may be.
Yeah, it could be the reason.
Could be the reason, yeah. Anti-inflammatories are one of the many groups of drugs that interact with warfarin. It can mean that the INR goes up. A high INR indicates that your blood is too thin, that it's going to take too long to clot, and that puts you at risk of bleeding. No bleeding anywhere, no bruising?
Nah, but this pain is unbelievable down this way.
And when did that start?
Yesterday.
Out of the blue? Did you injure it?
It was playing up a bit. No, I don't remember injuring it. That's the thing. I don't remember anything happening.
OK, and is there any bruising or swelling there?
Well, you can't really see things. Wrong complexion. It just hurts. Like I can't take the pain.
Right, let's get you up on the couch. You slip the trousers down for me. Let's have a proper look at the whole leg. OK, swing your legs round. So which leg are we talking about? It's very tender, isn't it? Hurting when I'm sorry.
It hurts. The push there, it hurts a lot.
Mm-hmm. It might be tied into your INR. It can be tied into your INR one of two ways. It could be a clot in the leg. Well, not with an INR of 7.7. Your blood's very, very thin.
Yeah.
There could be some bleeding in there, yeah? And that's what's causing... Because it's very tender, it's very tense. Right. I think I might need to get some advice from the hospital doctors today about whether or not we need to send you up. The trouble with the trade names is that sometimes they have paracetamol and ibuprofen in, and you know ibuprofen messes up your warfarin, yeah? But what we want to do is we want to get them some advice about whether or not we actually need to do anything else and get them to have a look at this leg, OK? When I examined his leg, it was very swollen and it was very tense. It felt full. And with
with knowing that his INR was raised, so knowing that his blood was thinner and that there was a potential for bleeding, that's what I wanted to rule out. If a patient were to be bleeding internally, it can be very serious and ultimately even fatal. So you all right to take a seat in the waiting room? Yeah? You get yourself sorted out.
I've been in the last hour, so...
Oh, I'm sorry. I will just talk to the medics and we'll get some idea about what we need to do next, OK? Take a seat outside. I'll make some... Keep that with me, please, yeah? I'll let you know what's going on, OK?
Thank you.
And can I make an appointment while I'm here as well? The doctor that I saw last time, a woman, she sent me to the hospital. And that was just a waste of time, so I need to go back to her and say to her what happened. It was just ridiculous. Doctor wouldn't even look at me, he wasn't interested. He was a busy man.
Oh my God,
He must have
really?
been about 25 if he was a day. I've got grandchildren older.
Hey, Sean, come on in. Hiya. Spoken to the hospital and they want to see you this morning to check this out, OK? It's not impossible. It's more muscle problems in the leg, but it's odd that you don't remember doing anything and it's odd that your INR is so high. So what we want to make sure is that the pain in the leg isn't due to any active bleeding. If it is, then what they'll want to do is give you something to reverse the warfarin, yeah? Okay. And give you some painkillers that you can take that isn't going to mess it up more, yeah? They're going to see you at ambulatory care at Wexham, yeah? So if you go up to A&E and explain, you've got an appointment there at 10 o'clock, I'd go straight up there now. Is that all right?
Thank you very much.
It's no problem, yeah? So they're expecting you,
Okay.
yeah?
Thanks a lot.
Bye-bye.
Bye.
He was sucking a sweet as well, which is very, very, not at all. Shouldn't be done. But he was sucking a sweet in the end. Now my legs are killing me. I'm walking with a stick and I'm getting worse. I might as well just sit in bed and die.
Can you come tomorrow at 11:40?
Yeah, that's a lovely time for me. Just scribble it down on something.
Yeah, I will, yeah. I'll write it on a card for you.
But I don't know what day of the week it is anymore.
Down we come. Down we come. We're almost there.
Do you want me to run and see it?
I've got a delightful young lady sitting in with me, though. Is that okay?
That's wonderful.
Here we come. So we're going to jab your other knee today, yes?
Can I sit up here?
Yes, let's.
I can't sit down there.
No, let's get you up here in any case, because it's not as good as my other bed, which goes up and down very nicely.
Sorry. You can hear the bones cracking.
Yeah, was that your bones?
My hand. It's terrible.
So I'll get it ready, okay, and then we'll get
Thank
you
you very much.
swiped around so we can get
Thank
that done.
you so much.
I've got this bit ready already.
It was only a pleasure to hear the call come from you.
Oh dear. Yeah, not many people say that.
So what university are you at?
Oh, I'm actually passing graduate.
Yeah.
I know. Yeah, so I'm one of the junior doctors.
Okay.
Yeah, so I'm in my second year. I've just done a year in hospital. It's nice to come out here though. I've never really spent much time here.
Lovely.
It's lovely area of the country.
Burnham's lovely as well.
I've heard, yeah.
very
I think one of
nice.
the GPs did around there. He was telling her it was very delightful.
Was that Dr. Delicious saying that?
I'm sorry, no?
Mange. This is what they call him out of the drug clinics that I work at.
It's the delicious looking doctor.
Not sure about that. Most people say, oh, he looks like David Cameron. Yeah.
It's true.
Right, okay. Shall we try and swing you round?
You're all right.
Yes.
Almost there. This one needs to move over a little bit. Good on you.
Thank you very much.
So the object here is to try and find the kneecap. and you just sort of pop it down into underneath the kneecap. And the knee's easy because you know when you're in there, because if you eject, it goes in.
Yeah.
And if it doesn't, then you know when it's soft tissue and it's, and it hurts. There we go.
Thank you very much. That was lovely.
Lovely.
It wasn't sore.
Wasn't sore at all?
No.
I didn't really do it. Oh dear.
Yeah. Thank you very, very much. I'm so happy for this.
You're welcome.
Thank you.
Right, let's give you a hand up here.
Thank you, love. Thank you very, very much, love.
There we go. That's yours, Beryl. And so roughly 6 months, yes?
Yes, thank you very much.
Good on you.
Don't you want to operate on them now?
Well, yeah, we'll come back in about half an hour when I've finished, and we'll just do it.
Oh, sure. Thank you very much. All the best to you, love.
Bye-bye then. Yeah, see, I don't get Dr. Delicious like Mange does. So. Oh, dear.
Right, say bye to the doctor now.
You're going to wave. We're going to wave. There's a bit of a kind of opening of his hands there. Fantastic.
Bye-bye. Nice to enjoy your last day.
Bye-bye.
Bye-bye.
Thank you very much.
That's all right.
Thank you. Thank you.
You're welcome.
Hey, Chris, how are you? Okay.
Farnham Surgery's been to Pam. How can I help? Hello, it's Dr. Hyder. Come through and have a seat.
You all right?
Fine, thank you. And how can I help you today?
Oh, I had a really serious accident on a Thursday. I got my legs
gosh.
crushed.
Okay.
So...
At work or?
At work, yeah.
Right, okay.
I was, hard to explain to everyone. I was sitting, it's not sitting down, but I was working with my legs in between two rollers and cargo systems. Somebody activated a lane and a pallet, my legs were sitting down like that, crushed my legs against the rollers. I can explain it to you. Let me just get up. So if I was, by the time the roller bed come, I was like that against the rollers.
Oh.
The pallet's coming from behind and crushed my legs.
Right.
And literally.
It's me.
So yeah.
Yeah.
They would have been taken. It's 4 ton. So they would have taken them clean off.
Goodness me.
So it's a lot of it's psychological at the minute as well, because it's I get flashbacks and that.
Mm.
Scary. Obviously, I can't work at the minute.
You've got a lot of bruising there.
Yes,
as well.
it's coming out today. It's
And this cut as well.
No, this leg is actually not too bad.
But that happened at the accident.
Yeah, that's
right.
just pressure. I mean, I had an X-ray on Thursday.
Did you?
Yes.
Yeah.
And there's no broken bones, but
Okay.
she said there's a hell of a lot of swelling.
Mm. Is it painful on the shin?
The pain, that's not too bad to be fair, but it's when I walk around, it's more internal. So it's hard to pinpoint where it is. It's only when I put pressure on it and weight in it. I can sort of walk around all right, I just take that for support.
Yeah.
But I can't get upstairs properly. My job obviously involves me climbing up ladders, steps, because I'm a maintenance electrician. So...
Yeah, can you bend your knee okay?
Yeah.
So the knee bit's fine?
Knee bit's fine. Here hurts. That really hurts there.
And the X-ray, there was definitely no fracture?
No fracture, no. You've got to think, my legs must have squeezed to the side of my arms.
It's unpleasant, isn't
It is, yeah.
So you need a sick note. Do you need pain relief?
I probably would, yeah. And something, anti-inflammatories or something, would that help?
Yeah, I think it's pretty extensive bruising, isn't it?
So
and
the bruise is
swelling.
coming out, so...
I think a couple of weeks would hopefully mean that the bruising will start to settle,
Yeah.
but soft tissue injuries, they can take up to 6 weeks to resolve
Really?
altogether. I've given you the cocodamol. You can take
Yeah.
a maximum of 2 tablets up to 4 times a day. And then that's your sick note as well. So I've just written crush injury to both legs at work.
Thank you.
And we've done it from the 22nd to the 8th.
Thank you.
So if you're no better by the 8th, then come back and we'll see you again. And if it's worse, we can always see you soon.
Yeah.
All right.
Cheers. Thank you very
That's
much.
okay. Take care then.
Thank you. Bye-bye.
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 I don't want to waste 4 hours at Wexham Park, but at the moment I'm having severe facial problem and hitting my right arm, and I don't want to go to Wexham because I'm one of those patients that has fibromyalgia type things.
Okay.
So is there somebody I can get checked before I go?
Just a minute.
This is not affecting my voice at the moment. It's affecting my lips, my tongue. Normally it just goes down here. It started with a headache, which I've still got, and it's going down the left side of my body, slowly but surely.
Have you had this before?
No, not like this.
Yeah,
Yeah, it's going slowly, affecting the nerves down the side of my body. I don't know, that's what I'm worried about.
A month ago and said I was having a stroke, and I was.
It won't surprise me.
Okay, thanks.
If you take a seat for me, and I will just quickly speak to the doctor.
Okay.
Yeah, thank you. So it's not, yeah. Knock on his door.
Come in.
Hi.
Tell me.
She's
I don't know if she's having a heart attack, lady, but her whole left-hand side is going numb. She's got now a tingling in the tongue.
Let's get the ECG for her. Who is doing the merge treatment room?
Hello.
Alison, good afternoon. How are you today?
I'm good, thank you. How are you?
I'm fine, but one of my patients could be having a heart attack. I want an ECG done.
Okay then.
She is Karen Price.
Okay.
And shall I send her towards you? No.
Yeah, straight down towards 10.
Yeah, I'll take her there.
Thank you.
Thank you.
Thank
Cheers.
you.
Bye.
When she's done with that?
Sorry?
When she's done?
She can come straight.
Come here, yeah?
Yeah.
Okay, thank you.
I haven't had anything like this before.
Yeah. Your speech seemed to be okay.
I don't know, my tongue's always starting to tingle.
I mean, I know it's sort of the best thing to tell you, but I had a minor stroke a long time ago.
That's what I suspect this is.
10, 15 years ago. But I didn't know what it was, but my face started drooping from one side. I was really stressed, that's what I had.
Could you follow me? You okay to get up? Yeah? Sure. Don't worry, you can go slowly.
So just follow my finger, okay?
Stick your tongue out and waggle it from side to side. That's fine.
Open your mouth, show me your teeth.
Sometimes I can smell burning when there's no burning.
Okay.
Are you checking that I've had a stroke or something?
Come in. Hello, come and have a seat.
There we go, thank you.
How's it going?
Alright. I've been having headaches on and off for a little while. And today I had one at about 5 to 2. And as I was driving home, I got a pain down here. And it's now getting gradually worse. And my arm and leg don't feel...
Is it feeling very weak?
It's not so much weak as though it's not quite there.
Quite there. When you had previous heart attacks, what were the symptoms like? There was mainly chest pain,
I had
wasn't it?
chest pain. But this is nothing like...
ECG is absolutely normal,
that's what the nurse
which is good news in a way. Have you lost any power in your hands and legs, or it just feels like that?
It just feels they're lighter than this side.
Okay. Can I have a quick feel of what's going on? Examine you.
Yeah.
Try squeezing my fingers tight. Tight, 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 tight. Okay. In any urgent or emergency situation like this, it's important for a healthcare professional to be level-headed and calm, mainly because patients are in a state of anxiety. Okay. Push me away. Pull me towards you. Like this. Hold it like this. Push me towards you. That's good. Okay, I'm just going to quickly have a look at your eyes. Quite often, it's very easy to succumb to the pressures of the emergency and get the anxiety and the fear transferred onto you. And then the patients won't be reassured and they will lose the confidence in the healthcare professional. Hence, I was calm and level-headed. Close your eyes tight, 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 tight. Good. Clench your teeth for me. That's good. Oh, thank you. Sorry about that. So mainly at the moment, it's like headaches on the left side, tingling sensation, and feeling weak.
Yeah, I'm tired. It's like somebody's hit me with a baseball bat on the side of my face.
Thank you. Based on your symptoms and the scoring system, it would put you on some risk here. We need to exclude if there is any phenomenon like mini stroke. It might be worthwhile speaking to the High Wycombe Stroke Centre what they think we need to do. Is that okay?
Yeah. Thank you for your call. We are experiencing a high volume of calls and all available operators are busy. Please hold and your call will be answered shortly.
seem like we're having any luck today.
So if you are having a stroke, then
Well, if there are fast symptoms like complete weakness on one side, tingling, facial droopiness and everything, we advise patients to call 999. High Wycombe is the stroke center. That's where we get on-the-day investigations like MRI scan and everything. That probably is the way forward. As soon as they see this letter and everything, they'll be happy to see you in High Wycombe anyway. Is that okay?
Yeah, yeah.
Shall I give that to you?
I'll take that. Thank you, Ron.
All the best. Hopefully it's all going to be okay, all right?
Okay.
Take care. Bye-bye.
Hello there.
Hiya.
Come in. Sorry to
Sit
keep
down,
you.
Charles. That's all right. Sit down.
Hello, Charlie. He's had some pain.
Yeah, lower abdomen,
Okay.
right in the middle. Now, he's had this a couple of times over the last month or so, but it's not been to the extent that it was this morning. It's coming again. He said the pain is always there, but it like spikes.
Yeah.
And then he's doubled over and it's like cramping and stabbing.
Yeah. Okay. And when you do a wee, does it hurt you when you go to a wee, Charlie? When you do a wee?
No.
Doesn't sting. Good.
He goes for a wee a hell of a lot. Like, he'll go in the space of an hour about 5 times. I'm like, why do you go to the wee so much?
Sometimes boys, their bladders are slightly sort of weaker than women's, and you find that they tend to sort of go and they sort of get out of that. Now, if he's not getting any pain, it's unlikely to be an infection, but I think it's worth trying to get a urine sample at some point and bringing it in so that we can test that. You haven't had any diarrhea when you've been to number 2?
I have had one.
That was a couple of weeks back.
Oh, a couple of weeks ago.
1 week ago.
1 week ago.
1 week ago.
No,
okay.
I think it was a couple of...
I had to have toast.
It hasn't been constipated. It's not been like when you go on lots of little hard things and difficult to get out.
No.
No. Can I have a look at you and your tummy up on the table? Shall we jump up? Let me get this for you. Good man.
That's a good
Lie down. Good. That's good. Just open wide for me.
It was really warm this morning, actually. I've given him some Nurofen.
Relax. Just check his temperature and open that up. Okay, that's fine. And then that way. 36.4, so that's okay. Let's have a little feel of this tummy. A wee bit sore down here. Sorry. Have you had lots of wind? You're a bit windy, aren't you?
Yeah.
Yeah. Come and sit up again now. He's obviously getting some crampy pain and the bowels are quite active.
Okay.
So it sounds a little bit more like he may be getting a little bit of a bowel infection and he may end up in a bit sick or get some diarrhea again with it. Sometimes very early things like appendicitis can present just with general tummy pain. And at the minute, there's no indication that that's what it is. Good. I would continue doing what you're doing, give him some Nurofen, a little bit of whatever he fancies to eat, and a little bit of fluid every so often.
Don't tell him that, I'll be asking me for ice cream for lunch.
Yeah, whatever, in a sense, whatever he'll take. If he's getting worse or going downhill, bring him back this afternoon so we can just do a double check and make sure it's not anything like appendicitis or anything. But if you can get a urine sample, it's worth just, if you do, dropping it in so we can just check.
Got a pot or anything?
Yeah.
Thank you.
What am I going to have to do?
Oh, lovely.
Okay, young man.
Say thank you to the doctor.
Thank you very much. Pleasure to meet you.
Okay.
Okay.
Brilliant. Thank you so much.
Okay, not at all.
Cheers.
Well done, William.
Some of them at once. Look.
Sorry, doctor.
It's okay, Leslie. Come on in. Sorry, I'm running late. So, last time I spoke to you, I got you in to see Dr. Javed because you said your chest was worse, yeah?
What did they say you've got? What's your diagnosis?
Avian lung disease.
Hypersensitive to birds.
Well, they told me to get rid of my birds because I had about maybe 500, 600 different types of birds, which I can understand was giving me this problem.
They think that you've reacted to the birds and they think that there's damage in...
Well, the blood tests show that he reacted to the birds. I've seen it on the screen.
exactly.
He keeps saying it's not the birds, but...
What I mean is that they think there's some damage to your lungs because of the exposure to the birds, yeah? Okay? So, we need some advice from the chest physicians about how we move it forward. So that's the one that we can't get you an appointment. So twice we've got them to rearrange it and twice they've cancelled it. I can keep chasing.
I've told him that the doctor can only do what she can do.
Yeah. So what I can do is escalate it, and we've escalated it from this man's appointment was cancelled because of the doctor's strike and you haven't booked it, please book one, right the way through to an urgent referral being faxed.
Yeah. One of my main concerns at the moment is his mood, his depression. This man is getting more and more depressed every day. He's been my friend for a long, long time, over 13 years. He talks suicide, he talks all sorts of things, and I'm just so frustrated to see somebody deteriorate so much in 6 months. It's soul destroying.
What am I going to do? I mean,
it's two things. Yeah, there's the depression because you're feeling so ill, and there's the fact that you're on a high dose of steroids, which will make you depressed. Yeah. And every time we try and reduce your steroids, your chest flares up. If I could stop your steroids, that's what I'd do. But every time you try and drop them, you really struggle, don't you? We've spoken before about the fact that they won't constantly do scans and x-rays, but what they need to be doing is deciding what they need to do. Yeah? What I want them to do is tell me about your medication, yeah? Because I think that if we could change the sorts of steroids you're on or reduce the amount of steroids you're on, then I think that a lot of the other symptoms would improve.
But the trouble is, one of your biggest things is you do just need to. I know it's very hard, but you need to just relax about what's going on around you medically.
It's very hard
because
but
everybody's doing the best that they can do.
Well, you know that, don't you?
It's very hard on your own because your head you start thinking the worst all the time. Your head, I seem to think the worst.
Well, that's been one of what they think you have would account for your symptoms. We're just really struggling to control them at the moment. From the point of view of chasing the chest physician, I will do it again.
Thank you very much, Doctor.
And I'll see you then. No, it's fine. It's nice to meet you, Pam.
I mean, he just gets very frustrated, and I mean, I know he's got all these things, but a lot of his things are exacerbated by anxiety. I know they are. Bye, nice to meet you.
Bye-bye.
How are you doing?
Yeah.
Let's take a seat. So, there's a few problems.
Yeah, I heard.
Yeah.
I've sorted it out. They were supposed to have a script for me just in case I didn't get what I got from you. And like I said to you, they only give you 5 minutes, and I said to them, yes, I got from Dr. O'Donnell, but you only gave me up until the day I got to him.
But the doctor says that...
I know, she said, I chatted to the owner.
You told them you hadn't seen a doctor here.
No, I told them I have.
2 weeks before this consultation, Yasser came back to the practice and saw me after an absence of 2.5 years. He told me that he had moved back into the area, and so this was the first time that I'd seen him. His problems are dependence on opiates and benzodiazepines. The reason he came to see me that particular day was for his prescription for diazepam. But he omitted to mention that he'd been to his previous GP 3 days before and had gotten a prescription.
She's trying to say, I've got a script from there and I've got a script from here. And I said, it's not right, it needs to be sorted out.
Why did you go back to Dedworth at all?
They rang me and said...
But you should say, I've moved to a different practice, I've read
I said that. I said, it was about the script.
Yeah.
They said to me, come get the script. And I said to him on the phone that I don't need it. I'm with Dr. O'Donnell, because she phoned me and said, no, you've got 2 scripts. And then I was like, what? And then I went there and then sorted it out. I took my dad with me because of proof. And then he went in and then he chatted as well and goes, look, my son didn't do that.
Well, it does look very suspicious. It damages trust.
Morning, ladies.
Morning.
I have an appointment, Walter Godley.
Take a seat next door. Take a seat next door.
Thank you.
Seen lots of gentlemen today.
Sorry?
Seen lots of gentlemen today. It's making a change.
So this is your third one?
I've switched off because of the children in there.
Yeah, it gets too much.
They're a bit noisy.
What do you want to see the nurse for?
Because I can't hear.
You can't hear? Right.
How are you?
I can't hear a thing.
All I can hear is like a whining noise. Yeah.
It's Dr. Bajwala.
Is it a lady?
It's a man.
Yeah, man.
Right, how can I help you today?
I've lost my hearing right here.
Right.
Part of my hearing right here.
Sorry, what happened?
Sorry?
What happened?
Saturday or Sunday, I put my finger in me and a brown blob of wax came out of my ear. And then maybe Tuesday morning, the hearing sort of like went about 90%.
Okay.
Last night it just kept going and coming and going and coming.
Is there any discharge? Why you put your cottonol?
Not since the weekend.
Okay, so what's the reason you've had your cottonol still there?
The wife put some olive oil in last night.
Oh,
and said,
okay.
Don't take it out.
You should never put the cottonol because it will absorb the oil. Okay, let's have a look. So have you taken any painkillers?
Sorry?
Have you taken any pain relief?
Yeah, I'll take some paracetamol. No, it didn't work.
Do you use earbuds?
Sorry?
Do you use earbuds to clean your ear?
I did try a weekend.
With this year or that year?
That year.
Okay, so you never...
I've got no problems with that ear, except for partial deafness anyway.
Yeah, because your ear looks a little bit perforated. Let's have a look here. Never use cotton buds.
Oh.
It looks a little bit infected as well. Okay, there is a little bit of infection there.
Oh.
Sorry. So what I'll do is I'll give you some ear drops. It looks a little bit infected.
Sorry?
There's an infection there in your ear. So I'm going to give you some antibiotic ear drops and some pain relief. I want you to come back and see us next week, Monday. There's a little bit of cottonol hanging out. Let me take that off. Yeah, so take some paracetamol. If that helps, carry on. If it doesn't, come back and see us. Okay?
So you want me to make another appointment?
Next week. Anytime
Do you want
next
me to
week.
make an appointment for next week, or do you want me to make an appointment next week?
Make an appointment next week.
So next week, if it's still there...
No, we still need to see you.
Do you?
Yeah.
So I'll make an appointment now?
Yeah.
I'll
Before
make
you
an
go.
appointment for next
If you
Wednesday.
can, yeah.
I'll do that.
All right? Take care. Bye-bye.
It does look very suspicious. It damages trust.
I could regain the trust and I could bring my dad here. And
No, it's not your dad, it's you. The trust has to be with you.
Yeah.
Because, if there's a hint that you may be working the system.
No, I'm not.
No, but if there's a hint that so it is up to you to make sure that everything is absolutely above board and that it seems as if it is, that it's apparent and clear to everybody that it is above board. But if there's something that's not right about it, then that interferes with the trust between you and me and between the trust between you and all of the doctors who are available to help you. And so...
I'll promise you, I will... If I get medicated, I'll promise this will not
Well, you can
happen.
promises...
I'm saying it's...
Yeah,
I'm away from there.
Yeah, well, promises don't cut it. And we have to be sure, in terms of safe prescribing, that that's what's happening. Managing how you choose to prescribe for any patient can sometimes be a challenge. In substance misuse, sometimes people are in this situation because they're afraid of being without their medication. Duplicity or deception isn't what they're trying to achieve, but it's their way of making sure that they're not going to go without. Our concern is not so much the deception, it's making sure that they're not unsafe and that in particular we're not contributing to a reduction in safety in prescribing. The point is that twice, on 2 occasions, you've gone back to Dedworth after you've had medication prescriptions here, and you've said that you didn't get a prescription here. And that's...
Twice?
Twice, yeah.
No, that's impossible.
Well, I'll have to check this out because I can't issue a prescription unless I know what I'm doing. Do not go back to Dedworth again. If you have any sniff of getting a prescription from 2 doctors at the same time.
I'll promise you that's not going to happen. This is just a misunderstanding.
And what we'll do is we'll need to put you on daily prescriptions. I know, but this is not my doing. This is you messed up here. And if you continue to do this, then we have to go down this route anyway, because there's no way out of this.
So I have to come every day?
No, you have to come to the pharmacy every day and pick up. And if everything is going well, then we can begin to relax the control. But that's what we have to do at the moment.
Thank you very much, Doctor.
You're welcome. If they've any problem, they can ring up from the pharmacy.
Yeah, and you can keep a check if you...
Yeah, I will. I'll be watching it closely, yeah.
No, because
Okay.
I want you to regain the trust with me because I've known you for a long time.
It's important, yeah.
And
It's important,
I want to keep that trust. I don't want you to look down on me. Like...
No. I wouldn't. I'd never look down on you anyway. This is just purely a question of trust.
Yes, that's what I'm getting at.
It's really important you don't mess up.
Yeah, so I'm going to prove to you that I wasn't. And
Do.
You'll take it from there.
Yeah.
Thank you very much.
Yeah.
Thank you.
You take care.
I'll see you in 2 weeks.
Yeah, absolutely. Yeah.
I used to sing in school.
Did you?
I used to be a big Britney Spears fan, so if we used to go places and then if something was getting delayed, my teacher would be like, quick, go off stage quickly and sing a song. Oh my God.
Oh, sing us one song.
No.
Please.
No. I was in dancing as well.
I remember when my eldest joined the choir and she was tone deaf and I used to say to her, mine. Don't sing, just mine.
How can I help? I had a lot of issues with my stomach. It was diarrhea continuously. Last 3-4 weeks I was suffering. Okay. The doctor done some test.
The stool.
That's correct. And still same issue because I was suffering with overactive thyroid, but my thyroid levels are perfectly fine.
Good.
Because if the thyroid levels played up, that's what happens as well. Then it's another issue might be. Still, I'm in the same issue. It's not getting better.
Okay. Your stool sample was clear, so that was good. Okay, but let's go through a couple of things. How long has the diarrhea been going on for now?
We're talking about 1 month now, isn't it?
Okay. And 4-week history of diarrhea. How many times a day are you opening
Oh,
your mouth?
Christ, sometimes back to back. 6 times.
6 times a day?
Easily.
Yeah. 6 times per day. Any blood or mucus?
I didn't see it. I should have, but I just...
Any vomiting?
No.
Any tummy pains?
When I have to go, start rumbling. I'm ready. It tells me, come on. That's it.
So you need to go and open your mouth.
That's it.
And then you
after
expect
that,
you after you
and then
open
after, just calm down.
Any weight loss?
I tried to lose weight anyway, which I successfully lost because last year I was 95 and now I'm 85 now, which is I want to do it because I cut down all the processed sugar and everything for my
And you've been
diet.
exercising as well?
Exercise, I do lots of exercise, yeah.
Okay. And have you been abroad recently?
No.
And anyone in the family have any bowel conditions like inflammatory bowel disease? Ulcerative colitis or Crohn's? Can I have a feel of your tummy? Just going to gently press. No pain anywhere in the tummy? Nothing. That's good, okay. One of the examination that we should do if someone's getting persistent diarrhea is examining the back passage to make sure that there's nothing worrying that we can feel in the back passage. Are you happy for me to do that today? Yeah. Okay, now what I want you to do is lie on your left side and bring your knees up towards your chest, okay?
Hello. Come through, have a seat.
Thank you.
How are you?
Everything was fine today, yesterday.
Yeah.
I've seen the midwife, community midwife, because I just got the birth 3 days ago.
Congratulations.
Thank you. So everything was fine, but my boobs, they're a little bit swollen. And what she says probably is infected.
Okay. So they're painful and they're swollen?
Painful, they're swollen, they're big.
They're getting red?
Slowly but surely.
Okay, any temperatures?
I don't know, I didn't check it, I'll be honest.
Okay.
I was so
Do you feel
tired.
well?
I feel okay, but it's painful. It's very painful.
Are you breastfeeding?
Not now, I think, because I'm just scared to do it.
Okay, but you have been?
Yes.
So you've been expressing milk?
Yes.
Ah, okay, fine. Okay, let's just check your temperature. And baby's okay?
Baby's okay. She's doing well. So I can't complain about baby. It's just me.
That's normal. Do you want to come behind here? Okay, I just need you to take everything off, including your bra. Just sit on the couch, okay?
They're so big and wet and painful.
Okay, I'm going to have a feel. Okay.
Already they are painful.
All of them?
Mm-hmm.
Very swollen, aren't they?
Mm-hmm.
And tender.
And I have to say, yesterday was like half. Today morning is like double everything.
I think this one's less than this one. This one still has some
It still is painful for me. It's both same. If it's about pain, maybe it's.
And the milk's coming out okay. Sorry, just 1 second. It's coming out okay. Yeah. That's fine. Get yourself dressed. So, yes, they are swollen, they are tender, and they are slightly red in some areas and very warm to touch. So, I'd like to give you some antibiotics just in case there's an infection going on. So,
I don't think so. I can cope another day.
Okay. It's 1 tablet 4 times a day.
Okay. So if I had the antibiotic, can I still feed the baby?
Yeah. The one that I'm going to give you is fine to take while you're breastfeeding. Okay, so it's absolutely okay to do that. They're not getting any better or it's still the same. You need to come back and see us, definitely. All right.
Okay.
There you go. All right.
Lovely. Thank you so much.
No problem. Bye-bye.
Thank you.
Bye.
Okay. Essentially, it was reassuring. Okay, so when anyone gets persistent diarrhea, there's lots of things that we think about. Okay, so obviously one of the things that we've got to rule out is infection. Okay, and normally, like I said, it settles down, but it's good that we sent the stool sample off. There was nothing that was shown in that stool sample. The other thing that we think about is inflammation. So there is another stool sample that I want you to do to look for inflammation in the bowel that can cause these types of symptoms. Does that make sense? Okay. Yes. The other thing, of course, that we think about is anything worrying going on, okay? And normally it would, there's lots of different signs and symptoms. So persistent diarrhea with blood, weight loss, etc. Does that make sense? Yeah. And there's a couple of other blood tests that I want to add just to make sure that we've ticked all the boxes to make sure that we've investigated you thoroughly. Does that make sense? After these investigations, if the symptoms persist, then we may need to get you up to the gastroenterologist specialist to have a look and see what's going on.
Okay.
Lovely.
Doctor, thank you.
No trouble.
I need to get to the bottom of this
yes, absolutely.
issue.
So I'll see you in 2 weeks. Yourself, I'll see you in 2 weeks and then we'll move things forward from there. All right, then?
Thanks.
No trouble. Lovely to see you. Bye-bye now.
Trying to avoid that big blood vessel.
So it's painful. Oh, yeah.
Oh my God, no, don't go any further, please. That's really hard. Oh my God, no, please.
Okay,
oh.
so it's aggravating. I'm sorry.
How can I help?
Oh, just a couple of things really.
Yes.
First thing, I was in hospital again at the
Yes, I
weekend.
read.
The week before I was in, then again at the weekend, and they actually tried me on different antihistamines, domperidone.
Oh, yes.
I've got them with me just to show you, make sure I got the name right.
Yes.
They actually gave me some that were out of date, so I needed some more.
Okay.
I don't know how it ends, there's so many they have to deal with, but just it worked quite well because cyclizine makes me feel a bit sick before I feel better. But apparently these have their side effects as well, so I'm quite keen to try them.
You can, but in some people, these can have these kind of psychotic episodes where they get certain spasms of the neck and that kind of thing. It tends to happen more in children. I can give you a short course now, but I think it's for when you have the flare-ups.
Yeah.
I think long-term, stick to the cyclizine safer. Yeah.
Tolerance to the other two.
Samantha is a 24-year-old patient of mine with ongoing chronic abdominal pains. She's under a hospital in London with the gastroenterology team undergoing numerous investigations. However, she's still getting these chronic intermittent cramps.
Because I'm on a lot, I'm on tramadol, morphine as well.
You're on, so I've got hypropranolol. Are you still taking buscopan?
Yeah, 8 a day.
Are you still on cocodamol?
Yeah.
Amitriptyline?
Yeah.
Lansoprazole?
Yeah.
Citalopram?
Yeah.
And do you still need the Cosmocol?
Is that the Movicol?
Yeah.
Yeah, I've got some at home in the hospital getting quite
So
a
if
lot
I
of
go
pain.
to add drug, it'll tell me whether these will interact as
So
well.
I'm on tramadol and I'm on morphine as well.
See, there we go. So
Oh wow, yeah.
but basically, having amitriptyline, citalopram, and domperidone, these affect the heart. Basically, that's the other side effects.
How often do you have it dressed, Queenie?
If you feel something sharp, tell me and I'll stop.
Yeah, I can slightly feel that.
Actually, on my legs then.
Right, so there's quite a lot of discharge on the dressing.
Come in. This is Holly.
Hello.
She's with us for the afternoon.
Right.
Alan, could you sit up on the couch, please?
Yeah.
Just saves me bending down.
Of course I will.
Lovely.
But without being, just Holly, now I've got to drop your trousers,
I'm happy if you are. Right, how's the legs feeling?
The right leg is on its 4th week, isn't it?
Yeah, 4th week.
If you have a look and you say it's okay, then I'm still on my 6-week plan. But the left leg is still a little bit oozy, but not much.
Alan has a condition called lymphedema. Lymphedema is a disorder of the lymphatic system whereby fluid is not being drained away from the tissues adequately. This can happen in any part of the body, and in Alan's case, it's in his legs. Alan's condition is lifelong. However, he has a very positive outlook on life.
Coming in for dressings regularly? Yeah. For a year and a half.
I used to come in every day.
Down to once a week now?
It's once a week now. It used to be every day, and Sheila would run and hide.
OK. So you're just having it put on like this with the yellow line over, are you?
Not on the right leg.
No, on this. We're just doing the left leg.
What that is, they put a little bit of the green.
Bit of green.
OK.
And then they've been putting the padding over the top of it.
Sure. It's really helpful if patients have additional support at home or family that will help them at home. Initially, Sally was doing some dressings at home to save Alan coming on a daily basis. And this was also freeing up appointments at the surgery for other patients that needed care.
So yellow lines just sort of essentially to hold it all on like a big sock.
Yeah. Right, this is my problem because I haven't got the strength.
Do you want me to get some gloves on and hold things in place?
Yeah. Maybe pull at the top would be easier for me, thank you. That's fine. OK.
That's fine.
Oh, dear.
I'm just watching.
Do you want me to do the second there?
No, it's fine. It's fine. Thank you.
I've been thinking about cake, and I've decided that I have to give cake a miss for a while. But I enjoy looking at it, but I'm resolved not to eat cake this afternoon.
So we won't force it on you.
Thank you. This is a bigger shock than Brexit. Yeah, Jim refuses cake. Yeah, it's such a shame.
I don't understand.
Look, this, I understand this. I have to slim down. Yes.
When was the hospital admission again?
I got out on Saturday, so I went in Friday early hours.
Is it for tummy pain?
Yeah, same as always. And
Is it right or left side?
Right side,
Right.
yeah. They think it might be a valve for my pancreas, but they're not too worried about it yet. They're trying to get the pain under control.
Oh, the sphincter of the valve.
It's been
Yeah.
for 4 years now. They're trying to get the sphincter problem under control. If it is that, I'm seeing Hannah Smith on Monday to sort of get more.
So follow-up women at Hammersmith Hospital, is that next week?
Yeah, because I had Botox injected a few months ago now, beginning of April, and they want to see whether that helped or not. It hasn't, but they need to discuss
Where
it.
you had that injected?
In Hammersmith, they did an endoscopy, went back in, injected the sphincter muscle with the Botox.
Oh my goodness.
But it was trial and error, it's quite a new thing. Nothing's eased with the pain, but I was willing to give it a go. So now they might decide to inject more, or they might decide to try another treatment now. So touch wood, I'm just hoping something eases it, just so I can get back to work, you know. Just I want to get back to normal.
What do you
really.
do as your job?
I was in an office, I had a little office job, customer service, because I like talking, it was really good. But I had to let it go. I was a liability on my painkillers. I was not well, I had to let it go.
And on these medications, are you driving at the moment?
No, I can't. I don't want to biscuit. If I have an accident, I'd feel so...
Yeah, because some of these medications can make you drowsy, so we always have to advise against operating machinery or driving.
Yeah, that's one of the reasons why I had to leave the job, because it was in a warehouse. So obviously the machinery rules going around and everything, it wasn't for me, you know.
Samantha is on numerous medications to help alleviate some of her pain. Some of them are to help her nausea, some are to help relax the bowel. Other medications she's on are opioid-based, like cocodamol and tramadol. One of the concerns that we have in treating young patients with long-term pain management therapies is that they can develop a physical dependence and even an addiction to certain opioid-based medications. Therefore, it's really important to keep these as a short-term use only at low doses and eventually try to wean them off these medications.
And you're not taking any other illicit drugs, anything over the counter, herbal, nothing like that?
I try like multivitamins, but just to try and boost my immune system.
At the moment, carry on with the propranolol, the higher dose. I can see on the last consultation with one of the locum doctors that they put you up to 20 milligrams. Carry on with that 3 times a day. We increased your citalopram to 40 milligrams.
Yeah, I'm happy on that now.
So carry on with that, and I think let's see you again in 4 weeks' time with that.
Please, yeah.
And with the domperidone, as I said, it can affect the heart. There is side effects. I'll give you 7 tablets just for the 1 week now, and then after that, carry on with your cyclizine. Is that all right?
That's fine,
So just use them in an emergency if and when you get a flare-up. Is that all right?
That's fine. Thank you.
Okay, so let's do that.
It's just sort of keeping me comfortable to find out what's going on, you know.
Sure. There you go. Take care. Nice to meet you again.
Oh, thank you.
Oh, take your time.
Straighten up. Thank you very much.
Take care. Bye.
Do you want a job, Sally, over the summer?
I've got 2 weeks off. Starting from Friday night. Well, if you ever get stuck over the next 2 weeks,
Bless you.
just let me know and I'll come in and help you.
We have a laugh because just as they patch me up with one thing, I get something else. I was rushed in for a triple bypass.
No.
Yeah.
We still can't get rid of him that way, can we?
Yeah, as soon as they're healed, I'll think of something else.
Oh, jeez.
Always fancied a lobotomy.
Behave yourself. I remember when the very, very, very first time you
That was
came.
you and Dr. Morris.
And I hadn't been here that long.
No. He made that drastic mistake, didn't he? He said, oh, God, Sheila, I think we better book him into our surgeries.
Forever.
Forever, by the looks of it.
And he wasn't wrong.
Done.
All right then.
Good job.
Right, is that it now, Sheila,
That's
for
it.
another 5 months?
If only. Right, so,
Have we got an appointment for next week?
Yeah, another one at 2 o'clock in the afternoon. Yeah.
right, I'll have a look and see if that's me. I might just have a day's holiday. Right.
All
Lovely,
this
lovely to see
you know what I
you.
mean?
Lovely to see
Right,
you.
I'll get the bus out now.
Do you?
See you later.
Bye.
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 I'll just leave the door for a minute.
Yeah, no, it's hot.
Because you have to put full stretch on it.
Yeah, yeah.
It's hard work.
Bye-bye, little man. Superstar. All right, there you go. Bye-bye then.
Thank you very much,
All right,
Doctor. Yeah,
okay,
thanks very
nice
much.
to see you.
Okay,
Thank
bye-bye.
you.
Right, thank you very
Best of luck, okay? Have a good trip. Bye-bye. Take care then.
Have a good day.
Bye-bye, you too.